The problem with breastfeeding is that it's one of those things that everybody expects to be easy. I'm going to get pregnant, then I'll give birth, then I'll breastfeed. But that's not what actually happens. Much as most mothers think I'll just get my breast put in the baby's mouth, milk flows until the baby chooses to stop or I choose to stop breastfeeding. That's not what happens. Most times mothers actually experience a lot of breastfeeding problems. And in Uganda, we've not had a lot of quality care for mothers in this department. So these are some of the issues that mothers usually face. Having no breast milk after they give birth, having little breast milk, feeling a lot of pain in their breasts or their nipples while breastfeeding. Unfortunately, they usually tell them that's okay, that's normal, just guma. Now you're a mother, we suffer. But that's not true. If you're feeling pain in your nipples while breastfeeding, if you have cracks in your nipples, you're getting wounds, your nipples are bleeding, your baby is failing to latch, you've discovered you have flat or inverted nipples, after giving birth, most mothers don't even know that their nipples are not inverted, what you'd call protruding. But there are different types of nipples. You may find a mother who has flat nipples, inverted nipples, protruding nipples, a mix of all, and it may be difficult for the baby to latch. Usually mothers, when they experience these problems, they just abandon breastfeeding with time and resort to other ways of feeding their children. Of course, we know that children who are not breastfed appropriately face a lot of challenges, both in their childhood and even when they grow, because a child who has not breastfed laxat ends up missing out on a lot. So the reason I'm here, part of the team of the specialists at Nakasero, is to give you the skills and the knowledge that you actually need. If you're feeling pain while breastfeeding, you shouldn't be. So you can come in for a consult and we can determine where is the problem coming from. You can actually be able to breastfeed pain-free if you're not having enough breast milk after giving birth. If you're going back to work is a whole other issue. Usually when mothers go back to work, milk disappears, the baby refuses the breast. You left a nanny at home with your pumped breast milk, she's pouring it away because she thinks pumped milk causes cancer. Even your own nanny needs to be educated on these things. So please do not miss out on this opportunity to meet with a professional here at Nakasero to be able to know everything you need to know about breastfeeding. We're going to be holding breastfeeding classes periodically. We'll be announcing them. Bring your nanny, bring your mother-in-law who is forcing you to give formula to your baby. Bring your husband who doesn't want you to breastfeed. Bring your friends who are expecting to have babies. Come yourself, come and learn something. Make sure you can breastfeed exclusively for 6 months as a working mother, or as a mother who is staying home with their baby, or as a mother who has failed to breastfeed their previous babies. You can breastfeed all the way to 2 years as is recommended. How are you going to do that when you're working, you may ask? We have the answers here. Don't miss out on this. It sounds like a new service, and it is a new service for most mothers in Kampala, but you can benefit from it.